more than 130,000 people nationwide.
South Florida becoming one of the country's latest coronavirus hotspots. Miami-Dade County seeing record numbers of new coronavirus cases.
We have one empty bed in the COVID ICU, and in the hospital, we now have over 65 COVID patients.
Hey, we gotta go intubate 15.
After the filming finished, things got actually a lot better. They started slowing down a lot. We even considered closing down our COVID unit. But since then, things have started to pick up little by little again. We're seeing this new Delta strand come in. So things are starting to come back up, and it looks like we're going back into another wave.
We were actually down to 3 total COVID patients in the hospital at one point, and not that long ago, just a very short time ago. We didn't have any ICU level of care. Jackson was huge with the vaccine programs and helping to vaccinate, and it made a huge difference. Because at that point, we didn't have the Delta variant, so the vaccines were protecting all of the elderly who at that time were the ones who were the most susceptible. And the younger people who were getting it, they didn't get that sick, so they weren't coming in. We had our numbers down. We were all excited. We were very busy because a lot of non-COVID patients that had been waiting for care were starting to come in. But then the Delta variant came, and in just a very short time, just a few weeks, it has shot up from 3 to 30-something patients. It feels like it was overnight. And these patients are different. They're sick. They're young. They get sick fast. It used to be a COVID would come in, and it would take a good 4 weeks before his lungs would completely deteriorate if he was going to be one of those patients that didn't do well, get on a vent. Now I've got patients deteriorating in 1 to 2 weeks, which is really difficult because they're young. And in the medical field, we know that everybody dies. And when we know someone has lived a nice full life and they die, at least we know they lived a nice full life. But I've now lost a 40-year-old with a pregnant fiance. I've got a 49-year-old, had a 23-year-old that we referred for transplant. These are sick people. And the most frustrating and amazing part of this is not one of them needed to be here. The vaccine is almost 100% effective at preventing death. Had everybody gotten the vaccine, we'd be done with the masks. Normalcy would be back, but that's not the case. And it's really frustrating because, throughout this whole process, we knew the vaccine was going to be the answer, right? Treatment options for viruses were never going to be that great. They never have been historically. Vaccine has always been the way you get rid of viruses. We got rid of polio. We were able to get rid of measles if everybody was vaccinated. We knew it was going to work, and then we got it, and it's working, but we can't get everybody to take it.
At least from the nursing perspective, we're tired. We've been working like this already for a while, and we got a little break in between the Delta variant and the original strand, but now it's like picking right back up again. So, we needed a lot of staff again, a lot of hours being worked. It's kind of a deflating feeling like a nurse to know that you're back again to when we originally started.
Especially when we have the answer. It's a very frustrating disease when we didn't have the answer, and we're trying to come up with everything we could, but then now we have it. We have the answer, and it's right there. And it's not just that people are stupid and don't want to take the vaccine. There are some very smart people who don't take the vaccine. And even in hospitals, 40% of people aren't taking the vaccine. That's scary, because those are people who just sit there and watch people die at alarming rates and are still afraid of the vaccine. And I think a lot of that is the misinformation. I think people just don't understand that this is safe. We've also now studied this in billions of people. Billions of people have gotten the vaccine. And we know, and billions of people have gotten it for up to 6 months. We know that there are no significant side effects. Yeah, things can happen, but when you compare it to what happens to getting COVID, it's nothing. No one has died from the vaccine. 600,000 have died from COVID. That's insane. It's getting really hard to keep watching people die knowing we could stop it.